Once again, I'm Adam Mesereau, Media Relations Director for Advocate Aurora Health, joined today by Dr. Jeff Barr, President of Aurora Healthcare Medical Group. That's Dr. Jeff Barr, President of Aurora Healthcare Medical Group. I'd ask again that you please ensure your connection is muted as a courtesy to others on the call. As you can imagine, we've received many media inquiries over the past few days. Our media relations at aah.org inbox is the best place to direct inquiries on this matter and others. Again, that's media relations at aah.org. We'll start today by asking Dr. Barr to offer an update on the situation at Aurora Medical Center Grafton before posing some of the questions that you've submitted. We won't be able to get to all of them, and frankly, many of them will need to be directed to the Grafton Police Department or other authorities involved in the continuing investigation. But for now, Dr. Barr, I'll ask you to offer some opening remarks.
Yeah, thanks, Adam, and good afternoon, everybody. I'd like to thank all of you for joining us today. And in just a moment, I'll get into the specifics of the events of the past week at Aurora Medical Center Grafton, but I'd like to begin today by reinforcing what health experts across the country have been saying all along. The currently offered vaccines against the novel coronavirus are safe and effective, and we know that the vaccinations are the way out of this pandemic. We at Advocate Aurora Health are proud to report that over the past 16 days, we've administered initial vaccine doses to more than 23,000 of our frontline team members across Illinois and Wisconsin. And while reports have indicated that the initial nationwide rollout may be slower than that for which many had hoped, we want to continue to encourage people to step forward to be vaccinated as soon as they're able to do so. We're working closely with the public health agencies on the continued rollout to our own team members on preparations for Phase 1B and the broader rollout to the general public. We cannot stress enough that getting vaccinated is so critically important to finding our way out of the pandemic. Turning to the situation at Aurora Medical Center Grafton, many of you have already read our statements this week, first Monday, and then again yesterday, on the progress of our internal review related to the vaccine vials removed from refrigeration. And here's what we can share today. On Saturday, December 26th, in the early morning, one of our pharmacy technicians discovered what turned out to be 57 vials of Moderna vaccine, enough for about 570 doses, outside the refrigerator in which those vials were stored. The vaccine vials were returned to the refrigerator, and the technician reported the incident to superiors. The pharmacist responsible for removing the vials maintained that this was an inadvertent error that occurred while the individual was accessing other items from the same refrigerator. In the subsequent hours, clinical leaders conferred with one another and, based on the information available, determined that the vaccine was still able to be administered on the morning of December 26th, given the 12-hour period of viability after removal from refrigeration. We proceeded with vaccinations at Aurora Medical Center Grafton before the remainder of that vaccine was discarded due to its having been rendered ineffective. Over the subsequent days, as we continued our internal review, we became increasingly suspicious of the behavior of the individual in question. The individual was suspended and, after multiple interviews over the course of the week, admitted yesterday to intentionally removing the vaccine from refrigeration. Additionally, the individual admitted to removing and then returning the vaccine to the refrigerator overnight on the evening of December 24th into December 25th. No vaccinations were administered on December 24th or December 25th. But this means that the 57 vaccinations that were administered on December 26th were rendered less effective or ineffective. The 57 recipients of those vaccines have been notified. At this time, there is no evidence that the vaccinations pose any harm to them, other than being potentially less effective or ineffective. We have been in communications with Moderna, and they have reassured us there are no safety concerns about administering vaccine that may have been out of refrigeration for too long. We'll be partnering with them and the FDA to figure out a strategy on future vaccinations for those 57 affected individuals. Importantly, there is no evidence that the individual in question tampered with the vaccine in any way other than removing it from refrigeration, leading to what is known as denaturing the vaccine. There is no evidence to suggest that this individual tampered with any other vaccine administered at Aurora Medical Center Grafton. This individual is no longer employed by us. We also notified the Wisconsin Department of Health Services, the Grafton Police Department, and the FBI. This is now a law enforcement matter. It's important to note that despite the actions of one individual, the vaccine program here and across the country remains safe and critical to getting us out of the pandemic. That has not changed. As we move to questions, please understand that because this is an ongoing investigation, I won't be able to answer every question and may have to direct you to law enforcement.
Okay, thank you, Dr. Barr. Let's dive into some of the questions we received. Many of those that have been submitted were covered in Dr. Barr's opening remarks. And again, there are many others that will need to be directed to authorities that have taken on the investigation. Dr. Barr, one question we received from so many news outlets, can you talk about efforts underway to shore up protocols or security process?
Yeah, Adam. One of the very first steps we took was to review our processes and identify any gaps that could have led to this incident. It's become clear that this was a situation involving a bad actor as opposed to a bad process. We've certainly used this as an opportunity to have additional dialogue and share any learnings around our processes. We're first and foremost a safe clinical enterprise, and we remain so through this and will be after this. But really, again, we feel strongly that our processes are sound, but again, this fell more to this being a bad actor involved than a bad process.
Dr. Barr, how did we know this individual didn't tamper with additional vaccine?
Well, the venue in question, Aurora Medical Center in Grafton, had not received vaccine prior to the date in question. Because everything is so thoroughly documented as part of our protocols and the vaccination process, we've been able to identify when the vaccine arrived at that campus and match that with when the individual could have had earliest access to the vaccinations. We're confident these were the only 57 vials impacted.
This question keeps coming. Can you give us any more insight on what the individual's motive was?
We're really not able to make any judgments on motive at this time. That's something that I'm sure will be looked at by the authorities that are now handling the investigation.
We had several questions come in. What does this mean for the vaccination program at Aurora Medical Center Grafton? What's the impact on vaccinations to our team there? And maybe you want to speak more broadly about the vaccination program across Advocate Aurora Health.
Well, we've been able to very, very quickly adapt to the situation as it stands, and we were able to secure additional vaccine from other sites within our system. So I think that's one of the benefits to having a system with our size and scale. And we've already received additional shipments. So the vaccination program at Aurora Medical Center Grafton, and quite frankly, all of our sites, continues as planned.
Can you talk about the contact that's occurred with the 57 individuals who received the vaccine?
Yes. So we've been in contact with those individuals. They are being notified, and we've also made available We've made qualified team members available to the 57 individuals to answer any questions that they might have about what's next. Additionally, I'd add that Moderna has clarified there will be no harm or negative effect from having received the vaccines that were rendered ineffective. Still, it's understandable that questions remain around the potentially reduced effectiveness of the vaccines administered. And we're staying in close contact with these individuals to answer questions as they occur.
Sure thing. Dr. Barr, we're receiving some questions around the numbers, looking for some clarifications around that. And perhaps this is because I think the number of vials is the same as the number of individuals. Can you talk about vials, doses, and the individuals who were vaccinated?
Yeah, I'd say it's a coincidence that the number 57 has shown up in a couple spots here. It was approximately 57 vials, and that equates to just around 500 doses, if not a little more. And it happened to be 57 individuals that received the vaccinations in question as well. So again, we keep very solid records on on lot numbers of the vaccines, the vials from which vaccines were drawn to administer these individuals. Obviously, we take down contact information, names and personal identifiers for anyone receiving vaccine from specific vials. So we're able to cross-reference that. And that's been a process that's been in place, not only for COVID, but all of our vaccinations that we administer on a daily basis across our system. So that was very important to us, very good record keeping to make sure that those individuals and only those individuals who received this vaccine were contacted. And as I mentioned, we maintain contact with those individuals to make sure that they're feeling as comfortable as possible through what I know is a stressful situation for them.
Thank you. Before we conclude, would you like to offer any closing thoughts?
Well, again, I think we're offering this information in an effort to be as transparent as possible, because maintaining trust of all the communities we serve and the individuals in those communities is so critically important. That's the underpinning of our Safe Care Promise, and we've not wavered from our Safe Care Promise throughout this, providing safe environments for people to be treated not only for COVID, but to maintain oversight and care of all their health and wellness concerns. And we're continuing to reinforce the safety and effectiveness of the vaccine, not just within our system, but nationally. We've come together with other healthcare systems to really support the vaccination efforts nationally to bring a sooner end to this pandemic. At the same time, this wouldn't sway me from encouraging people to pursue care of their chronic health conditions throughout this. It's never been a better time or a safer time to maintain your relationship with healthcare organizations and your healthcare professionals to ensure that you're living as well as you can.
Thank you so much. We're seeing a number of questions come in that have already been covered. I just want to remind everyone, look for this video to be posted shortly on our news center under the section COVID-19 updates. Please continue to route your media inquiries to mediarelations@aah.org. Again, mediarelations@aah.org. Thank you again for joining us. I'm wishing everyone a happier and healthier 2021 and appreciate your time. Take care.
Thanks, everyone.